How do you find legitimate studies?
Hmm.
When you say there's so many fraudulent studies out there, a lot of the viewers, they feel so confused because there's so many opposing
Hmm.
views and sides.
There's something called the evidence hierarchy, and they say, well, this level of evidence beats that level of evidence. In order for that to be useful, you have to assume that people have the best of intentions, they're not trying to defraud people, and they don't have any special interests or vested interest in industry, which is just not the case.
Mm-hmm.
The vast majority of research studies that come out and get published are industry funded, either directly or indirectly. And so all of these people are compromised. Coca-Cola alone spends 11 times the amount of money on nutritional research than the NIH, National Institutes of Health. And that's just Coca-Cola, not Nestle, PepsiCo, Kellogg's, General Mills, and all the rest. So there's the vast majority of money going into this is corrupt, and then they're paying people off, and we know that the sugar companies were paying very, very prominent researchers off for nearly 100 years now at the least. And they weren't telling anyone about it, which is illegal, right? It's certainly unethical. It's very hard to trust these things, but it comes down to something that Richard Feynman, the physicist, said, which is, it doesn't matter how brilliant your theory is, and it doesn't matter how smart you are. If it doesn't agree with experiment, it's wrong. And you can sort of adapt that to, it doesn't matter how great your study is, and it doesn't matter how well-renowned the researcher is. If it doesn't agree with reality, it's wrong. I don't care what the study says. If they say that, that a koala should eat, bamboo shoots and a panda would do better on eucalyptus, I'm gonna doubt that, honestly. Or a whole bunch of lions and fed them asparagus and others gazelle and say, wow, they do so much better on asparagus. I'm just gonna call bullshit on that every time. You have to look at first principles. You have to go look at our actual biology. Studies are fine, but hard facts are hard facts, and hard sciences are hard sciences, and biology is a hard science. You get a study and say, oh, well, look, we had these people and we did this and we followed that and we found whatever we found. If that doesn't align with the observed phenomena, it doesn't matter. You can manipulate data any way you want. And some of the major researchers in this field are people like Professor Willett from Harvard, Professor Gardner from Stanford. They are out and out vegans. They have been for decades. They're strongly affiliated with industry and the big processed food industry. The Seventh-day Adventist Church, at least Dr. Willett, is strongly associated with the Seventh-day Adventist Church. Whether he's a member or not, I don't know, but he has done a lot of work with them, and they are religiously anti-meat. I don't know about Dr. Gardner, but he's been a self-avowed vegan since the 1980s, and I think from his own words, it was more that he liked the cultural aspect of it. He liked being in that community more. It wasn't really, is this better for me? Is this a health thing? It was just like, oh, I like being a vegan or something like that. It was some sort of quote about that. So this is ideologically driven. It's very difficult. So you need to go to first principles. You look at biologically, what are humans? What have we been eating for millions of years? A hard rule of biology is that adaptation. Life adapts, and if you don't adapt, you die. And so this adaptation takes hundreds of thousands, millions of years. And for the last few million years, we have been eating meat, and some predominantly meat, and sometimes exclusively meat, especially during the ice ages or when we had enough meat available. So we are well adapted to meat. And there's nothing harmful in meat anyway. If cholesterol was a problem, we would have adapted to that millions of years ago. And it's not, because every animal on Earth basically eats saturated fat and protein, or absorbs that. And so that's a major issue. We see indigenous populations like the Maasai, back when they were eating their traditional diet, which they aren't anymore. They are getting more chronic diseases because Coca-Cola has trucks that goes into the Maasai villages every day and sells out within minutes. And they're getting grains and nonsense coming in. They're getting diseases that everyone else would as well. But when they were eating their traditional diet, they did not get these diseases. They had very high saturated fat diets. They had very high meat intake. They did not get heart disease. They did not get cancer. They did not get diabetes when eating their traditional diet, which they are not doing anymore. The Inuit, same thing. When they're eating their traditional diet, they just don't get these diseases. They don't get heart disease. And they're genetically predisposed to, actually. There was a study in 1996 or 7 that looked at this. They said, well, they're very high risk. They eat all this fat. They don't eat veggies, and oh gosh, they don't get any fiber. And they start smoking from a very early age, as young as 8 years old. I've seen, so which is very young, and that is a risk for heart disease. Their rates of heart disease were much lower than the rest of Canada, and they said, okay, well, they must be genetically adapted to this and protected against heart disease. And so they looked for the different genetic risk factors for heart disease, guessing that they would have all the protective ones and none of the harmful ones. In fact, they had all the bad ones. And so they had the perfect genetic constellation for developing heart disease, and yet they were getting it at a much lower rate. And so the authors just completely like, we have no idea what's going on. We don't know. I mean, because they're super high risk because of their lifestyle, and yet they have much lower rates, and they smoke and they eat fat, and they have all the genetic risk factors. So maybe there's something else that's going on that's protective, or maybe these genetic risk factors aren't all that they're cracked up to be. Since then, I've seen studies come out saying, well, people say that the Inuit, have pretty low heart disease rates, but, is that really true? And they start looking at the current numbers in the 2000s, and they find, oh, well, look, their heart disease rates are higher now. It's just like, you're proving my point. You're proving everyone's point, because they're not eating their traditional diet. They're not eating seal blubber and whale blubber and polar bear and things like that as they traditionally did. They're drinking Coke, they're drinking alcohol, they're smoking cigarettes, they're eating trash. They're getting sick as a result of it. So you're proving the point. You look out through the entire 20th century, people have studied this decade after decade after decade. Very low to no rates of heart disease and cancer in the early 20th century. And then every 20 years or so, they'll say, okay, well, let's look at it now, and it's gone up a little bit, but still very low, and then up a little bit, and up a little bit, and up a little bit, and now in the 2000s, it's even higher than that, and maybe it's higher than the rest of Canada. I don't know about that, but there's certainly a study that suggested that. Well, what's happening? They're being more involved in Western society, and they're being more involved in Western ways of eating, and they're getting sick as a result of it. So that literally proves the point. And so if you want to be dishonest, then you just look at the ethnic population and say, oh, look at that, they have more heart disease. Well, that's not the question we're asking. We're asking, is their traditional diet good or bad for heart disease? And in fact, that shows that it was good, it was protective, and that the new diet, the Western diet, is very damaging and a very high risk for heart disease.
How would